Hi there, I'm Dr. Matthew Schulman, board certified plastic surgeon, and today let's talk about the 5 stages of a tummy tuck recovery. So before we start, let's talk about what a tummy tuck is, and you probably already know this. A tummy tuck is a procedure that's designed to rejuvenate the abdomen. So it's designed to give you a flat belly. We do that by removing the extra skin that's hanging. Maybe you have extra skin because of pregnancies or aging or weight loss or weight gain. We also tighten the abdominal muscles that often get separated during pregnancy. That's called a diastasis rectus, and we repair that with internal stitches. And then commonly, we do some liposuction. So it's a way to remove the skin, the fat, and tighten the abdominal muscles. So that's a tummy tuck. So maybe you're thinking about having a tummy tuck. Maybe you've just had a tummy tuck. Maybe you have a friend or family member getting a tummy tuck, and you want to know about the recovery. When we talk about recovery, I think it's important to break it up into different stages. So I like to talk about the recovery in 5 different stages. The first stage would be immediately after the surgery, so while you're in the recovery room. Stage number 2 would be the first 48 hours. So really those first 2 days while you're home recovering. The third stage would be the first 2 weeks after surgery. The fourth stage is the first 4 to 6 weeks after surgery, when you're probably starting to get back to a little bit more normal activities. And the last stage of recovery is really what you have to do, what you can expect 6 months and further out from your tummy tuck procedure. So let's go into these stages a little bit more specifically. So let's go back to that first stage I said, which is immediately after the surgery. So your tummy tuck is going to be done in an operating room like this. This is not a green screen. This is my office operating room. So this is the real deal. So you will have your tummy tuck in an operating room like this, whether it's an office, a surgery center, or even a hospital. You will be under general anesthesia, which means you will be completely asleep. And then after the surgery, which could take anywhere between 2 and 3 hours, depending on your surgeon and exactly what you're having done, you will move into our recovery room. So we will wheel you into the recovery room. My patients are generally still sleepy when we bring them to the recovery room, so most people don't even remember being in the recovery room. They just remember waking up there. At that point, you will be taken care of by a nurse. You will have your vital signs monitored, so they're going to monitor your blood pressure, your heart rate, your breathing, your oxygen level, and make sure that you're comfortable. Most of my patients will stay in the recovery room for about an hour and a half or 2 hours. At that point, you'll start to feel a little bit better. Not great, but a little bit better. So we'll sit you up, give you a little bit of something to drink, maybe some ginger ale, maybe some apple juice, something that's really easy on the stomach. You'll probably have a little something to eat, maybe some crackers or some cookies, just so you have something in your stomach. And then we'll start moving you a little bit. You'll walk to the bathroom with assistance, but then you can go to the bathroom, you can pee. Surprisingly, while you will have some pain in the recovery room, a lot of the anesthesia that we give you during the surgery is still working. So your abdomen and your sides probably are still a little bit numb, so it's not that uncomfortable. The discomfort and the pain usually kicks in later. A responsible person, either a friend or family or a nurse, will come and get you and bring you to where you're staying. And we'll start to enter stage 2 of the recovery process. So as I said, stage 2 is really the first 48 hours after your surgery. This is generally the toughest part of the recovery because now you're home, you're swollen, a lot of the medicines that we gave you during the surgery are wearing off, so you're starting to feel pain and pressure and bloating and all that stuff that you hear about. This is totally normal. So what you want to do for the first 48 hours is just rest. You're going to be in bed. I like people to stay in an upright beach chair position, meaning I don't want you laying flat. Remember, we just pulled your belly really tight, so you're not going to be able to lay flat. So you're going to be on your back, and you're going to have some pillows under your head and some pillows under your knees, so you're flexed, kind of like a beach chair. If you have a recliner at home, that's perfect. That kind of gives you the perfect sleeping and resting position. So that's the position I want you to stay in. I don't want you staying in bed or in the lazy boy the whole time. I want you getting up and moving around. Walking around is really good for your circulation. It helps the blood flow, it helps prevent blood clots, and it's good for the breathing. When you get up and you walk, your chest expands, your lungs open, and you can get good breath and good oxygen to your body. You want to make sure you're drinking a lot. After surgery, you're probably not going to be that hungry. I get it. And that's totally normal. So you don't have to eat, but I want you to drink. So I want you to stay hydrated. So if you should be drinking water, if you want to drink some electrolytes like Powerade or Gatorade, that's really good for you. If you want to have some juice or maybe some protein shakes, you can do that as well. Just keep yourself hydrated, because it's very easy to get dehydrated after surgery, because when you're swollen, swelling means that all the fluid is leaving your blood and going into your tissue and making it swollen. If that's happening after surgery, which is normal, and you're not drinking or eating, you can easily get dehydrated. So you want to drink enough fluids so that when you pee, you're peeing very light colored or clear. If you're going to the bathroom and your pee is coming out dark, that means you're not drinking enough. So that's a good way to see if you are staying hydrated enough. Like I said, I want you to drink and try to eat. Again, don't push the food because you don't want to get nauseous. You want to eat small meals. If you're hungry, eat a little bit. If you're not, don't. It's okay. So the first 48 hours is really just you resting, staying in a good position, getting up to walk around, drinking a lot of fluids, and eating a little bit if you want to, and also controlling your pain. You will be prescribed pain medicine from your doctor, and this is the time when you're probably going to need it. So you want to expect to have some pain during the first 48 hours. Now, as we get into the first week or two after surgery, this is when things start to happen a little bit faster. Now you're feeling a little bit better, and now you're able to get up and walk around. You're not walking around for exercise, but you're able to walk around for a longer period of time, walk farther distances, and just function. You should be able to dress yourself and wash your hair and wash your face, and if you have kids, you can still interact with your kids. So around 1 or 2 weeks, you're starting to feel a little bit better. You will still have pain. The pain should be less intense than it was during the first few days after surgery, but you're still going to have some pain. So it's not uncommon during the first week or two after surgery to still require some degree of strong prescription pain medicine. But in general, I like my patients to transition over to non-narcotic pain medicines like Tylenol. While you're walking during the first 1 or 2 weeks, you're going to be walking hunched over. Again, remember, I pulled all your skin down, so you're going to feel like you're tight. And I want you to walk hunched over, kind of like an old lady. And that's going to help take the pressure off of the skin closure, the incision. So for the first 2 weeks, it's okay to walk hunched over. I don't want you stretching, okay? I don't want you doing that for the first 2 weeks. So you're gonna feel the natural urge to be hunched over. It's okay, just go with it. I still want you to sleep in that beach chair position so it takes the pressure off of your abdomen. So again, head up, pillows under your legs. You're kind of in this beach chair or V position. That's the way you're gonna wanna sleep for the first couple weeks. During this time, you will come back and see your doctor. We'll do a post-op visit. You probably have a drain that was put in during your surgery, and that drain is usually removed after the first week. So this is the time period when you would come in and we remove the drain. This is also the time when you'll start to initiate some scar care. So we'll start to initiate some taping of your incision or some silicone scar gels to your incision to help promote good scar formation. So this is the first 2 weeks of surgery. Now let's move to stage 4, which is 4 to 6 weeks after your surgery. This is around the time where you're feeling pretty good. You're probably back to work. You're probably back doing things with your family. It's normal for you to have a lower energy level, so you're gonna be tired a little bit quicker than you were before the surgery because you just haven't gotten your strength yet, but you can start to become more active. You can also start to go to the gym. I don't want you doing any heavy lifting yet, but you can start to increase activities at the gym like treadmill, elliptical, doing some light weight exercises. So those are the things that you can start doing. So around 4 to 6 weeks, you're basically getting back to normal. This is also the time where you're gonna look down and say, hey, my belly looks great. So you're gonna start to see the improvement that you got because now you're not as swollen. The swelling has gone down, your belly's nice and flat, that extra skin is not there anymore, and the scar is starting to fade. This is the time when you're starting to be happy with your surgery. Up until this time, you probably were having your doubts and regretting it a little bit because that is not your final results. Now we're starting to see it a little bit, but again, still not your final results, but you should be happy around this time. The last stage of the recovery is really 6 months. So now we're farther out from surgery. Life is back to normal. You're not really thinking much that you had the surgery. You're not really restricted. You can do anything you want in terms of exercise and activities and weightlifting and being at the gym. You have no restrictions. And now you're really seeing the results. The swelling has gone down. You should see the nice contour of your abdomen. Your waistline should be more narrow and the scar should be fading. So 6 months after surgery is a really good time for you and your surgical results. But again, final results may not be evident till about a year. But at 6 months, you're pretty close, so you should be pretty happy. So again, I'm Dr. Matthew Schulman. I'm a board certified plastic surgeon practicing in New York City. And this video was designed to walk you through the 5 stages of a tummy tuck recovery. I hope you got some valuable information from this video and maybe you learned something. So now if you just had a tummy tuck or you have a tummy tuck coming up, you have a little bit better understanding about what to expect from the time of surgery all the way through 6 months after surgery. If you like videos like this, you found it useful, make sure to like, comment, and share.